Hello, Professor Roizen. My name is Peter. This is my 28th attempt at this paper or this presentation. I'm not very good at these, but also, um, yeah. Anywho, hopefully this turns out well, and hopefully we have no more technical issues either. So this is the outline of my paper. I'll just dive right into it. When I look at the beginning of my paper, um, typically when I write papers, I do the body first, and then I add the bookends at the end. Because usually I use the body to kind of formulate what I want to say, what I think is going to be a good focus area, what I can find more research to focus on. But in this aspect, with most things, I always think the importance is the historical aspect. And so really just drawing that either in the first paragraph or going more into it on the second. I feel like it's going to probably fit more in the first paragraph just because I want to make sure I hit that or stay within the parameters for the number of words. So, but in that historical context, we'll talk about how her cervical cancer cells were taken without her consent, later becoming the massive breakthrough in technology and cell development, and then kind of talking about how we had all these massive breakthroughs and all these contributions to health, but the recognition was never given. And even her family members who should have been, um, well, recognized or compensated for Henrietta's death and contributions never got any of that. And so talking about that inequity. And those three main brackets kind of will trickle into my main focuses. So the first issue that I really like to kind of cover is the informed consent. And that is looking at literally just taking cells or taking people's tissue without their consent, and also the aspect of a lot of times when we sign papers to say that we quote unquote consented to something, we don't exactly understand the full aspect of what we're consenting to. Then we'll touch on racial equity. This is touching on how minorities, specifically blacks in this case, were taken advantage of and used as guinea pigs or tested or um, given what would be pioneering treatments that were extremely deadly, like her radiation treatment for her cervical cancer. And then also looking at the benefit sharing aspect, which kind of ties to that recognition and compensation that we talked about in Henrietta's family, but I'm going to expand more upon that, and we'll look at that in the next slide here. So you can kind of see the informed consent to health equity, but then when we look at the compensation or the reevaluation or recognition, I also want to dive into this biomedical versus public health ethics aspect because I think this is a critical component um, that needs to be looked at. And the biomedical, when I talk about biomedical, I'm talking about the kind of more informed consent, patient autonomy aspect. So respecting that individual. And then when we look at more of the public health aspect of ethics, a lot of times in public health, we're looking at the overall good of everyone, but it's also making sure that the way that we get to our end result is justifiable and ethical. And a lot of times that isn't the case. And so, really kind of dabbling and looking and expanding upon that is something that I want to do. Um, the ethical considerations that I put in here is just really kind of honing down on that racial inequity in healthcare access, the commercialism, which I think is really important, especially when you add in the afterwards in the book and what that touches on. I mean, some of the stuff, the fact that people's tissues, cells, blood um, can be used in stuff that they don't support, I think is very interesting. I'm always for like the medical advancement, and I think we should always be trying to create and innovate. But if somebody does not consent to their tissues being used for abortion research, or they don't believe in nuclear warfare, and so they don't want to have their tissues or blood being used for nuclear bomb testing or radiation poisoning or stuff like that, I think there should be some say in that regard. I'm not at this point sure how much of that is, and I think that's what I'll probably be thinking of as we look at um, suggestions or ideas for the future. But that's just some aspect that I think will be interesting to delve into more. I mean, obviously, the lack of transparency is a big critical issue that's going to be touched on in this paper. So I know within our um, rubric, we need to hit on some theoretical frameworks. So principalism is one of the aspects of the respect for autonomy, beneficence, and non-maleficence, or maleficence, and just overall human justice. And then looking at the communitarian, oof, aspect. That's the difference between the individual rights and the societal benefit. And then critical race theory, I really think I'm going to push on this one just because in today's modern world where this is actually something that's up for debate, whether or not it should be taught or not, I think goes to show how important it is, especially in this paper, where we can see a historical and modern effect of still racism and systematic oppression or uh, not abuse, but also manipulation um, that's taking place still today. And then when we look at recommendations for reform, I have ideas. I'm just battling these ideas in my head. And some of this is like the equity audits. So big focus is like, are more tests being done on a certain race versus others? And this has a plus and minus effect. So when we think about Henrietta Lacks's case, we see a lot of examples of minority populations, usually black, or economically disparaged, or the criminal, those who are in prison being used for research and tested on. And it raises, the ethical aspects of like these poor people are being injected with cancer cells without their real understanding of it. And then when it comes to the breakthroughs in research, those are not being utilized on those communities that were tested or taken advantage of, but rather to the wealthier white community that gets that. So that's, one of the things. The other flip side of that equity audits is like, are there groups that we're missing out on? That are being avoided in our medical research. Because as modern medicine advances, we see that there's a significant difference. I should say significant, but there is a large, considering that all of our medical research predominates around a white male, we're seeing a lot, especially in women's health, but just even in all racial aspects. Different races present for different risks or have a stereotype of certain risks that arise or are more displaced to certain things. And so covering those is also another aspect of that equity audits. Privacy risk or data breaches and stuff like that. Historically, I've never really been worried about that until the recent administration, and the fact that we're cutting so many different positions without really any um, conceived plan, but then replacing the people in those positions with really unqualified and potentially exploitative individuals who might use that information for personal gain or money is a real factor. And I never thought I'd be saying that, but that's literally something that we're seeing happen. And then looking at, well, we talked about the commercial exploitation already. Kind of looking more at that informed consent, we talked about that earlier. Yeah. And then looking at policy reforms and implementations, I think this is really interesting because would I push for policy implementations and change now with the current administration and the current public health administration leadership system? Probably not. And that's why I think it makes it interesting for recommendations for reform, because I think a huge component to this is timing. I think in a lot of other times in history, I mean, timing is always critical, but under different circumstances, I think it'd be easier to suggest these ideas of reform. But the fact that so much reform right now or challenges to the current public health administration's way of doing things is so high, and it's just based off of kind of skewed data points. This raises a really interesting concern for whether or not we propose that those recommendations now or not. So, and lastly, with the closing statements, talk about the need for ethical reform, reinforce the importance of Henrietta's contributions, how we couldn't have this type of ethical talk or research without a book on her like this, and then reinforcing that overall thesis that we had earlier. So I know I hit my 10 minutes right now, and so I'm going to stop there. Thank you so much, and I hope you have a wonderful night.